Good afternoon. My name is Rajesh, and I run the Pure Water Exchange out of Bangalore. And I want to first bring all of us onto speed on a national catastrophe or tragedy. So this is a scene from West Bengal. It's a Durga Puja boat. It's a prayer. It's a beautiful prayer, but it hides the fact that the water in that whole land is very highly contaminated with arsenic. And arsenic is the source of many life tragedies, like this person, this widow, whose children had to pull out of school and support the family. Arsenic causes cancer. It starts by the symptoms are feet lesions and hand lesions, so it's very hard for women to walk. When women can't walk, the husbands divorce them and marry someone else. When a man can't walk, the wife has to both support him and the family. Babies, this 11-month-old baby already has lesions on his hands, so he can't crawl, he has to be carried everywhere. How big is the problem? It's huge. And I'm going with the background because the problem is so big. 100 million Indians are drinking arsenic-contaminated water, and it is a man-made problem and is the largest source of poisoning in the world. The other problem, which is even bigger, and this is where all of us are touched. 600 and half of India's population does open defecation. The other half, which is most of it is in this room, who use toilets, 80% of all sewer systems in the urban areas are not working. Therefore, we are equivalent of guilty of practicing open defecation, and open defecation causes maximum human exposure to human pathogens. So the question we all in this room need to ask is any Indian safe? We are all completely exposed to a huge number of pathogens. We've talked a lot in this conference about health, but my question is, without good water, is any medicine useful? All our water is contaminated in many ways. India, as a developing country, doesn't show the health. One of the primary indicators of development is increased height. And of all countries in the world that has grown in development, India doesn't show that. And finally, there's a lot of profit to be made in the medical system, but the question is, can we cure this problem? So the simple formula for human health, we know, is exercise and fresh air and good food. For at a community level, it's very simple. Clean water, not mixed with any human excreta. That's the simple formula for community level health. And so for India, the solution is 100% coverage. It's not good enough, 50%, not good 70%, 100% coverage of sanitation, sewerage, and access to clean water. Okay, so what has to do this to do with mobile? Okay, so the Pure Water Exchange is a complete exchange to track all things water and sanitation, from funding through peer review to implementation, tracking, and networking, learning, sharing, and monitoring of all projects. So we work in 27 countries. We cover about 1,000 villages in India right now. We are trying to scale up. So how does the mobile power work on we are introducing a mobile on top of a platform that is 8 years old. And so what we want to do with the mobile platform is every water source documented. What's the status? Is it operating? Is it delivering water? What is the quality? Sanitation facilities, what are the states? Are they working? Are they being used? Are they being maintained? Any pollution issues, social issues, maintenance issues? So here's an example of, you can't read it very hard, so I'm just going to show that all the SMSs, over the last 2 years, we've received thousands of SMSs about construction. This one says good water, there's 4 feet of water level, and it's being used by so many people. On the top right, the water is smelling bad. So the people in the field can declare simple things like on the top left, a dead body was buried next to the well. Don't know why, but that makes it an urgent situation. There are objections to turbidity. On the one is the request for repairs. The villagers tried to replace the washer, but failed. So they're asking for repair. And the bottom right, if you can, anyone can read Tanglish. It comes in Tamil, in Tanglish, and so we
Rajesh,
collect SMS.
Just another minute.
Sure. We also work on projects to alleviate, in this case, arsenic. In this case, create dual EcoSan toilets. And the progress reports, monitoring, everything is online. It's visible to everyone, graphs of all the arsenic data. Our problem is that people are doing lots of water projects, but they don't want to be transparent. They don't want to know what happened to the project 6 months later. They want to track the financials and the operations. There's not money for maintenance. So that's my presentation. We have a SMS platform and Android, and you can come by our stall and see a demo on how we are tracking public toilets. We want every public toilet operator to just SMS 3 numbers a day. Number of men who visited the toilet, number of women, and any money revenues. And we can track whether toilets are operating properly, at capacity, under capacity, over capacity. Thank you.
Sorry, I have to make a comment. Can I ask you to go to the second last slide?
Sure. This one?
The previous.
Before that. Okay.
It's not showing up.
Oh, sorry. Oh, this guy. Okay. Which one?
The one just before the end.
This one?
No, the one with Mandela's quote.
Yes.
Yeah. I think I just wanted to mention, being a very proud South African, that today is Nelson Mandela's
It's his
birthday.
95th birthday.
95th birthday. Many of you have heard that he's not keeping very well. So it's a big day for us in South Africa, celebrating his heritage and what he says. The 3 big areas he stands for through his foundation, and that's shelter, it's literacy, and what have I left out? Food security, shelter, and literacy.
Right.
And we know water plays a big role in, in all of those areas. Thank you.
Thank you. Any questions?
Yeah, opening the floor for questions. Anybody? Please raise your hands if you have any.
Okay. Thank you then.
Rajesh, I have
Yeah.
a quick
No
question. It's
problem.
fantastic
I'd love
work. Your messages were coming in English.
Yes.
Do you also have regional languages
Yes.
through which they can
so
send
our
them?
SMS is completely language agnostic.
Okay.
So we don't translate them, we store them so the manager or the reader can read it in the native language.
Okay. That's all. Thanks. The next speaker, please. We can have. Thanks, Rajesh.
Next presentation will be from